drugs started out as anti-diabetes medications, and then we started to learn more about the cardio benefits and now the renal
Yep.
benefits.
Yep.
Whose responsibility is it to prescribe this drug to a patient?
That's a great question. I'm so glad you asked that. So that goes back to my previous point about almost like pick one that you're comfortable with and use it. I think that's the key message from everything that we're talking about. And along the lines of who should start it, from my perspective, it doesn't really matter who starts it. What I worry about is that people clinicians, I should say, get hung up on, should I use this one or that one? Is it for the renal or the CV or the endocrine indication, et cetera, et cetera. And I think that can lead to a lot of therapeutic inertia, which concerns me. And I think that cardiologists have to get used to using these therapies. Nephrologists, endocrinologists need to get used to using them, and so do primary care practitioners. And they need to be comfortable using them for all of those indications, and not to wait. So don't wait. I used to say, if the patient has a heart failure indication, I'm going to send a note to the patient's cardiologist to say, please start the therapy for their heart failure. I don't do that anymore. If the patient has an indication, I start it for their heart failure or for their nephropathy, less so for their glycemic control, because those aren't the patients who I see. But for the other indications, for the cardiorenal protection, I just start them, and I hope and I would encourage my colleagues to do the same, because the magnitude of the effect is very substantial, and the effects occur relatively soon after therapy, particularly for some of the benefits such as volume related issues like heart failure. So that's a really important point, I think.
Yeah, thank you for touching on that. It always, I think it's an exciting time to see a drug that has so many uses for so many clinicians. But I remember seeing a conference session titled once, something along the lines of, do SGLT2s belong to cardiologists? And seeing as they have so many effects, it's a sort of a bit concerning to think that it might get relegated
Yep.
to one field. And was there anything else that you wanted to touch on in regard to SGLT2?
I completely agree with you about that. Sorry, I totally agree with you about that. I think it's a really important point, and I think that's why a lot of the conferences in this area now will very commonly include an endocrinologist, a cardiologist, and a nephrologist, because there needs to be a lot of crosstalk in this area to make sure that we're not missing appropriate patients. So maybe the last thing that I'll just mention to you is that, because of exactly the point that you mentioned around who should be using therapies, we even have a multi-care, multidisciplinary clinic where I work, we call it a care clinic, CARE, for cardiorenal endocrine. So there's me from the nephrology side, I have a cardiology colleague and an endocrinologist, along with a pharmacist and a chiropodist and eye person. So take a picture of the back of the eye so that their retinopathy can be assessed, and a dietitian. And we basically assess each patient for, we look for a reason not to start these therapies, and not just the SGLT2s, but also GLP-1 receptor agonists. We look for a reason not to start them, and if they aren't going to start them because there's no indication, then can we get them into a trial where we could answer some of the questions that you've raised today, so that we fill in all of these data gaps. So, and in doing so, if the endocrinologist doesn't think there's a glucose reason, I'm looking for a renal indication to give a patient one of these therapies, because of how much they do in terms of preserving kidney function and reducing risk over time. And similarly, I could say the same thing for my cardiology colleagues. So I think that's my final point around sort of tying it all together, so that we can provide this kind of care to patients and not miss an indication when there is one.